Today we'll be discussing the case of Tanya Angus. It's spring of 2002. Just a few months ago, Tanya was living the life of her dreams. But in a matter of what seemed like days, everything turned upside down. It started off very subtly. At first, her rings didn't fit. Her shoes were then getting too tight. And eventually, her clothes were getting outgrown so fast, she had to replace them every few months. But one thing particularly concerning was that Tanya, who was once scouted to become a model, looked unrecognizable, even to her loved ones. There was very clearly something wrong, but getting answers was no easy task. Within just a few months, 22-year-old Tanya grew from 5'8" to 5'11", and her shoes went from size 9 to size 11. She saw multiple different doctors, but she was constantly being told that nothing was wrong. Tanya continued to grow unexplained. That was until one day she was seen by a very important doctor. And immediately after looking over her scans, she knew exactly what was wrong with Tanya. What Tanya was going through wasn't just rare, but it was rather something most physicians would only ever read about. What followed truly would just test the limits of medical science, personal strength, and humanity itself. And what Tanya would end up doing during all of this would highlight the crucial importance of early diagnosis of a condition like this. But before we get into this case, just to introduce myself, my name is Petal Palmer, and on this channel I post anything medical, mysteries, and crime. If that is something that sounds interesting to you, please consider subscribing if you end up liking this video. All right, let's get into this case. Tanya Marie Angus was born on Monday, November 27th, 1978, in a Las Vegas suburb called Henderson. Growing up, she had her mother, Karen Stratinsky, who was a medic, and she had a younger sister by 3 years named Susie. Additionally, she also grew up with a stepfather named Alan. Growing up, Tanya was extremely active with various different interests. She not only liked horse riding, but she also liked swimming and dancing. In fact, it was already by 7 years old when she was a diver, and by 14 years old, she was a ballerina at her high school. Tanya was described as having a very outgoing personality, and with this, she was very popular in school and had a lot of friends. Overall, Tanya thoroughly enjoyed her childhood. She did a lot of normal stuff, and going into her young adult years, she felt the same way. She was having a good time. Now, as a teenager and young woman, Tanya was described by many as a beautiful girl. She had long brown hair, she had long legs, she was just about 5 feet 8 inches, and with these physical characteristics, her mother, Karen, described how there were actually a few agencies who scouted her to go into modeling. She and her friends would also often play with makeup and model with each other, which is something she found really fun. But despite this, modeling was actually not something she was interested in truly pursuing, because a major goal of Tanya's was to get married and become a mother, specifically to 2 kids, a boy and a girl. And at some point, when she reached 20 years old, she was actually interested in pursuing a career in acting. In the summer of 1997, when Tanya was 18 years old, she was living in Las Vegas, and she had a bunch of things ahead of her in life. She had just gotten her first car, and she described this period stating, quote, "It was just a magical time in my life." But despite this amazing time she was having, it was around this time when her life took a sudden turn. One night during that summer, Tanya had been driving on the road, but very suddenly, she was in excruciating pain. Her head was pounding, and she described it hurting as if, quote, "like someone cut my head open and started hammering." The pain actually got so intense, she had to pull the car over. So Tanya pulled over the car, hoping she could let her head settle down a bit. But it was almost as soon as she stopped the car, when she began experiencing another concerning symptom because she suddenly began hearing a crackling sound in her head. But after lasting for a brief amount of time, this crackling sound suddenly stopped. Once everything settled down for a bit, Tanya finished her drive. And when she eventually saw her mother, Karen, she went up to her and was like, "Hey mom, like when I was driving, I had this really bad headache and I was hearing this crackling sound in my head." This was quite concerning to Karen. So after hearing this, she insisted that Tanya head to their family doctor to make sure everything was okay. They eventually got an appointment booked and went to the doctor to explain what happened. But in the end, he just concluded that these symptoms could have just probably been from stress. He told them that she probably just had a migraine, further describing that during migraines, sounds tend to be amplified in the ear, and he explained that this might have been the reason she was hearing this crackling sound when she pulled over. Because of this, he was like, "You know what? I'm going to prescribe you some pain medication, and hopefully that should help with the migraines." For the next few months, Tanya just did whatever her doctor recommended. But even with doing this, the headache still kept coming on. About once a month, Tanya would get a very bad migraine, and her mother would just see the strain on her face whenever these would come on. But as time went on, Tanya figured out how to manage them. And whenever Karen would bring it up that Tanya looked to be in a lot of pain, she would pretty much just reply like, "Oh yeah, everyone has their problems in life. I guess mine just happens to be headaches." For months, these migraines were just the new normal for Tanya. But it was also around this time when she met somebody who was able to distract her from this problem she was dealing with. Just before her 19th birthday, sometime before the end of November in 1997, Tanya met a man, and instantly, she and him connected with each other. They had great conversations, they would sit up and just talk all night, and after 6 months of being with one another and falling in love, they wanted to build a life with each other and decided to move to his home state of Michigan, 1,800 miles away from Las Vegas. Tanya was very excited to make this move for what should have been the start of what she'd been dreaming of happening in life. And when Tanya got to Michigan, she was having the time of her life. When she first got there, she was fascinated by the snow. She got to experience the season change, which she loved, and it was just an overall great atmosphere for her. She eventually found a job as a security guard, and very unexpectedly, she actually enjoyed this job. It was something she found fun to do. Tanya and her mother, Karen, would usually talk and catch up over the phone. And even through these calls, Karen felt that Tanya did seem very happy, which helped her accept the fact that maybe Michigan might have just been where Tanya belonged. Now, Karen would also ask Tanya how her headaches were doing, and Tanya would just reply that they seemed to be okay and that she'd been keeping herself busy. But while Tanya did just try to deal with these headaches, it wasn't too long when another concerning problem arose. First, it started with Tanya missing her period one month. And one day, her boyfriend noticed that there was milk coming from her breasts. This really worried her because she was thinking she might have been pregnant. So as soon as possible, she headed to the doctors to do a pregnancy test. Fortunately, she was assured by the doctors that she was not pregnant. Nonetheless, the doctor then told her that she might possibly have a condition called Marfan syndrome, which is, quote, an inherited disorder that affects connective tissue. Other than that, she wasn't pregnant, didn't have an official diagnosis, and was sent on her way home. For the rest of the time afterwards, most things were going just fine. But while one would hope that that would be the end of the health issues, there was one day Tanya noticed something very strange again. One morning in fall, Tanya just randomly began looking down at her hands, and she noticed that not only were her fingers wider and longer, but her rings were getting really tight. This worried her, so she decided to head to the local clinic to get checked out. She was seen by an on-call doctor and explained to them everything that had been happening to her. But after their examination, they determined that nothing was wrong with her and sent her home. She left this clinic just puzzled, and what only made this worse was that it was very soon after this when she noticed something else that was extremely strange. Because Tanya began to notice that her shoes were feeling much tighter. She decided to head to a shoe store to get her feet measured, and the news she found out there was shocking. Tanya had always worn a size 9 women's shoe, which was actually the same size as her mother's. But when she got measured at this store, her feet somehow happened to measure at size 11 women's. Tanya was extremely shocked because she didn't know how this could have even been possible. And she called her mom to tell her that they weren't the same shoe size anymore because now her feet were 2 sizes larger. She needed some new shoes that fit her, but she wasn't able to find any women's shoes that were that size. And because of this, she instead had to end up buying a pair of men's shoes. While it was already bad enough seeing all these extreme changes happening to her body, this wasn't the only thing Tanya was dealing with, because all the while this was happening to her, she began to notice her boyfriend treating her differently. As the months went on, it became very apparent that her boyfriend was increasingly distancing himself from her. In fact, at some point, he even began telling Tanya that she was gaining weight, and he was unhappy about this. He would actually often ignore her. But one of the worst moments was actually that very day Tanya bought the men's shoes. Once she came home and he saw that she had the shoes, he was questioning her like, hey, why'd you get men's shoes? And Tanya just answered that those were all that fit her. But as a reply to his thoughts on this, he told Tanya that she looked like a man. So Tanya replied to him asking, am I still pretty to you? And he just answered by telling her she changed a lot. This was hard for Tanya because not only was it hurtful, but she would look in the mirror every day and genuinely not see anything different about her. At the time, she felt like she looked like herself, but it was clear he wasn't interested in her anymore. Soon enough, Tanya was being questioned by others on whether she was a man or a woman. At some point, she had even called her mom and asked her if she was actually born a male and just been operated on as a baby. Similar to the story of David Reimer, who was born a male but raised as a girl due to a botched circumcision. It was just that all the comments she began receiving saying she looked like a man, she started to think it might possibly be true that she was biologically born a male. Over that next month, her boyfriend became more and more detached. And after all of this building up, one day he came up to her and told her that he was breaking up with her. Tanya, who was only in her early 20s at the time, was extremely heartbroken. And she began to worry that nobody would ever want her if they were uncomfortable about how she looked. But just adding on to that, her body continued making these strange changes. Her legs, her arms, and her hands were getting longer. And with this, she was no longer able to fit into her clothes. She would buy bigger clothes to fit into, but it became this cycle where she would wear clothes that only fit for about 2 months, and then she would have to buy new ones again because she grew out of them. Tanya was extremely alarmed by this, as she thought she was done growing years ago. And so she decided to go see another doctor. This is where she got the next shock because they measured her at this appointment and she was told that she was standing at 5 feet 11 inches tall. She was just 5'8" a few months ago. She asked the doctor how this could have happened, and she just replied to Tanya that it's actually not uncommon for some women to experience growth spurts past their teenage years. And she just said to her, you're probably still just growing, but that's all normal. But as Tanya's symptoms continued to just get brushed off as normal, more changes were happening in her body. She not only continued getting bigger, but she was experiencing pain in her feet, in her hands, and most notably, the strongest pain she was feeling was in her back. Not just this, but in a short amount of time, not only was her voice getting deeper, but every part of her face, so her forehead, her chin, nose, cheekbones, and jaw, were noticeably wider. She went to another doctor explaining to them about the growth, the migraines, the pain around her body, her back pain. But they told her that nothing was wrong with her. Time and time went on, and Tanya kept going to different doctors, but they all kept telling her that nothing was wrong and everything happening was all normal. Some attributed it to stress. At some point, one doctor even accused her of trying to just get pain medications to use for non-medical reasons. But she knew that something was wrong with her. Tanya called her mom to express everything that was going on. Karen just remembered Tanya sounding, quote, very depressed, which was heartbreaking for her to listen to. And with this, Karen told Tanya, like, hey, this doesn't sound good. I really think you should come back home to Nevada. Just a year ago, this didn't seem like it would be a reality. But right now, it was looking like it might be the case, especially because one incident soon occurred that completely changed Tanya's thoughts on being in Michigan still. One day in April of 2002, Tanya had a shift on duty at the department store she worked at. Inside, there were a few people, but in particular, there was a little girl and her mother. As Tanya was looking around in the store, she noticed that the little girl was yanking on her mother's dress. And very shortly after, once she got her mother's attention, the little girl looked at Tanya and asked her mother, is that a boy or is that a girl? As soon as she asked this, everyone in the store turned around and just looked at Tanya. And Tanya was absolutely mortified. She described the moment saying, quote, I felt like I wanted to hide and I wanted to put my head in a trash bin so nobody could see me. I was absolutely mortified. I couldn't handle it anymore. I just wanted to go home where there would be people who loved me. Once Tanya got back to her Michigan home, she packed up all her stuff, and it was the day after this when she got herself on a flight and flew back home to Nevada. Now, here's where the story gets a bit unclear, because in a documentary featuring Tanya and her family aired on the Oprah Winfrey Network, they say this was the incident that led her to leave her job and go home. But then several news sources, including ABC News, rather state that what happened was supposedly Tanya had been working as a supervisor at a Walmart. She did work as a security officer in Michigan, but at some point she must have found new work. Now, what the several sources are saying is that supposedly Tanya's bosses at the Walmart began noticing the changes that were happening to her. And it was allegedly because of this and them being freaked out by it, they fired her. And then what is also being said is that her boyfriend did in fact break up with her, but many sources are saying that this occurred after his own parents supposedly began questioning whether Tanya was a man. In the documentary by the Oprah Winfrey Network, Tanya was actually being interviewed by them, giving the whole story, but it's the narrator who explains the incident in the department store. And then regarding what's being said in the news articles, I'm unable to find anything of Tanya directly saying that. But for the most part, what stays consistent and what has directly been said by Tanya is that she was consistently being asked by people whether she was a man or woman. Her boyfriend did break up with her after he thought she looked like a man, and she did fly back home to Las Vegas in April of 2002. When Tanya landed back in Las Vegas, her mother was out of town at the time, and so her sister Susie went to pick her up from the airport. And as soon as Susie saw Tanya, after those 3 years of her being gone, she was shocked. Tanya looked nothing like herself, and Susie instantly knew something was wrong. She described, quote, she was unrecognizable. She didn't look at all what she used to look like. Tanya could just see the visible worry Susie had on her face. This started to scare Tanya, and Susie just had to tell her that she didn't look like herself. Something was wrong. Susie wanted her to be looked at immediately. So once they got in the car, Susie drove Tanya directly to a longtime family friend of theirs named Dr. Eleanor Kahita. Dr. Kahita was best friends with their mother, Karen, and she was actually Tanya's pediatrician when she was a child. Once she saw Tanya, she was amazed at her height and the enlargement of all of her features. And after doing a physical examination and listening to the signs and symptoms Tanya had been dealing with, Dr. Kahita knew this was very serious. She ended up ordering Tanya some hormone tests and an MRI. And for the next week, Tanya and her family just had to wait anxiously for those results to come in, which was very difficult as they were all extremely worried. Dr. Kahita finally received the results from the hormone tests. And instantly upon seeing it, she immediately knew what was wrong with Tanya. These results showed that Tanya had a very high amount of a hormone called growth hormone. Growth hormone is also known as human growth hormone and also known as somatotropin. This is, quote, a natural hormone your pituitary gland releases that promotes growth in children, helps maintain normal body structure in adults, and plays a role in metabolism in both children and adults. The pituitary gland is a small pea-sized gland that's located at the base of the brain. And, quote, the pituitary gland is sometimes called the master gland of the endocrine system because it controls the functions of many of the other endocrine glands. With the high levels of growth hormone she was producing, Dr. Kahita knew that something was wrong with Tanya's pituitary gland. Specifically, based on what she had seen, she just knew that Tanya had to have a pituitary gland tumor. Eventually, the MRI results came in as well, and Dr. Kahita's suspicions were confirmed. Tanya did have a pituitary gland tumor. In fact, this very tumor was actually almost the size of an orange. Dr. Kahita met up with Tanya and her family, and it was extremely difficult to tell them this, but with this being a pituitary tumor causing excess amounts of growth hormone to be produced, she diagnosed Tanya with a condition called acromegaly. Acromegaly is a medical condition in which somebody's body produces too much growth hormone. It is a rare but serious disorder, with an estimated incidence of about 3 to 14 of every 100,000 people being diagnosed with acromegaly. In more than 9 out of 10 cases, the cause of acromegaly is the result of a tumor in the pituitary gland, and these tumors are almost always benign or non-cancerous, referred to as a pituitary adenoma. Though acromegaly is most often diagnosed in middle-aged adults, symptoms can present at any age. Young adults or old adults can be affected by acromegaly. And early detection is crucial in giving the patient a greater chance for better treatment outcomes. After first dealing with these symptoms when she was about 17, 18 with the headaches, it was only at 22, 23 years old when Tanya finally had some answers. I do say 22, 23, by the way, because it is stated in all sources that she was diagnosed with acromegaly at age 22. However, based on the provided timeline of events, with it being 2002, she would have been 23 at the time, turning 24 later in the year. So general consensus is that it's just around that age, the early 20s age. Tanya was terrified to hear that she had a tumor in her head, and her mom and family were in shock and just heartbroken. Dr. Kahita wasn't sure how the disease set in, but she was confident that the reason Tanya had been suffering with the headaches and the migraine was the result of the tumor impinging on other structures in the brain. And if you think back to the time she pulled over her car and began hearing a crackling sound, an explanation for this could have been that the tumor began pressing on surrounding auditory nerves, which could have caused the crackling sound. And then eventually the tumor got so big, the pituitary gland then started to malfunction, causing it to secrete all of that growth hormone. As the family continued hearing more about the condition, they began learning that, unfortunately, Tanya's prognosis wasn't looking good. As a child and teen, our bones have these things called growth plates, which allow for new bone growth. As the child would grow, the growth plate would harden into solid bone. Once a growth plate is completely hardened into a solid bone, that would mean the growth plate is closed and the bone will no longer be growing. For girls, their growth plates would likely close around the ages of 13 to 15, whereas for boys, their growth plates would likely close around ages 15 to 17. Doctors have explained that usually when a person produces excess growth hormone before puberty, with the growth plates in their bones not yet being closed, this would cause the patient to grow upwards in height in a condition called gigantism. This is seen in the case of Robert Wadlow, who was the tallest man in medical history according to Guinness World Records. But on the other hand, when a patient produces excess growth hormone after puberty, once those growth plates are closed, it's expected that the person would grow outwards, with the excess growth hormone instead affecting their bone shape, organ size, and many other things. This condition would be called acromegaly. Tanya was diagnosed at age 22-23, and she first started showing strange symptoms at around 17, 18 years old. But it was around 21 years old, about a year before her diagnosis, when she started showing the symptoms of getting larger. What was rare about her case was that she not only continued to grow outwards, but she also grew upwards as well. The most common treatments for acromegaly are 1. Surgery, 2. Medication, and 3. Radiation therapy. Dr. Kahita tried assuring the family that with surgery and medications, it's possible that they could reduce Tanya's symptoms, because if they could get the tumor out, this could stop it from pressing on the pituitary gland and thus stop the excess growth hormone from being released. There was just no guarantee that this would work. While acromegaly is curable in some cases, in others it's not. According to the Cleveland Clinic, for those with small pituitary tumors, the cure rate is about 85%, whereas those with large tumors, the cure rate is about 40 to 50%. And while medication can't cure acromegaly, it can offer long-term safe treatment. That being said, doing this operation was extremely risky in Tanya's case, particularly because they eventually discovered that the tumor in her head was actually wrapped around her left carotid artery. The carotid arteries are arteries that supply blood to the brain, so if those were to get damaged in any way, she would not survive. With how risky this procedure was, it was truthfully a matter of finding a surgeon who was willing to perform it. At first, they had to make sure to find Tanya an endocrinologist because she was experiencing some thyroid issues. They eventually found one who got together all the possible medications he could to lower her growth hormone. But the tumor was, of course, still there, so she needed surgery to remove it. For 2.5 months, Dr. Kahita and the family searched endlessly for a neurosurgeon who'd be willing to perform the operation. All the while she was searching, Tanya continued to grow and face serious mental struggles about her condition. Though it was hard to accept the diagnosis, the family and Tanya were grateful to finally know what was wrong. But Tanya rightfully was really scared. There were even nightmares she would have sometimes of her growing so big she was taller than the Eiffel Tower. The first surgeon they were able to find was looking for $30,000 just to see Tanya. This is about $45,000 today. Finally though, after a long search, they were able to find a neurosurgeon who was recommended by other doctors named Dr. Martin Weiss at the University of Southern California, or USC. After further discussion with him, Tanya's surgery was officially scheduled for July 2002. Tanya was very scared of having to get surgery, so she definitely was very nervous about the brain surgery. Once that day came and Tanya was on the operating table, they performed a transsphenoidal craniotomy. This is a surgical procedure in which a pituitary tumor is accessed to be removed through the nose. And after 13 hours of working on the operation, the doctor came out to speak to Tanya's family. He told them that he had never seen a tumor take over the brain so severely. The tumor was in every little section you could think of in her brain. It was surrounding nerves. It was surrounding arteries. Particularly, as mentioned, the tumor was attached to the left carotid artery, which is a very serious spot. He was able to take out most of the tumor, but he just wasn't able to take out the parts connecting to the left carotid artery. So instead of her tumor being the size of an orange, it was now the size of a cherry. He informed her family that while they were able to remove most of the tumor, it wasn't possible for them to remove every little piece, meaning those remaining bits would still remain in her head, and unfortunately, that also meant that the tumor would continue to grow and her body would continue to grow as well. With this, it was pretty much guaranteed that this condition was going to shorten Tanya's lifespan. But this wasn't all. After the surgery, Tanya was extremely thirsty, describing, quote, "I was so thirsty, it felt like I hadn't had water in 10 days. It felt like if I wasn't going to get water, I was going to die." When the doctors came in to check on her, she was like, "Hey, I'm really thirsty." But the next day, when the doctors came back in, they asked her, "Have you been feeling thirsty?" So Tanya was like, "Yes, I said this yesterday. I was feeling thirsty." It was at that point when the doctor informed her that while he was doing the procedure the other day, he actually nicked a part of the anterior or front lobe of the pituitary gland near the hypothalamus. The thing with the hypothalamus is that, amongst other things, it helps your body manage thirst. So this area being nicked put her thirst out of whack. And with this, she was diagnosed with diabetes insipidus, a condition marked by increased thirst and urination. After Tanya was a bit recovered after surgery, the surgeon spoke with her about all of this information. And when he did, Tanya actually turned to her mother and said, quote, "Mom, I'm gonna die." As much as Karen tried to assure her, this was an extremely difficult moment for all of them. Not only did Tanya's hands and feet continue growing, but all of her organs did as well, including her heart and lungs. Over the next year, Tanya tried various medications and experimental treatments, but with the tumor also still growing, Tanya was left to undergo repeated surgery to make sure that the tumor didn't damage the areas of her brain that controlled major organs like her heart and lungs. The following year, in 2003, Tanya's aunt had come across a magazine which featured a story about a neurosurgeon named Dr. Takanori Fukushima at Duke University in North Carolina. Dr. Fukushima was a physician who also performed procedures to remove pituitary gland tumors, so they reached out to see if he might be able to work with Tanya. Tanya sent over her paperwork to him, and after getting a scan performed and seeing those results, he told the family that they needed to get Tanya to Duke as soon as possible, because the scans showed that the tumor had grown from being the size of a cherry to now being back to the size of a large orange. They made their way over to North Carolina, and Tanya was very scared for this surgery. She cried beforehand, and her mother actually had to hold her hand up until they administered anesthesia. This procedure again took 13 hours, and similar to the first one, the tumor was essentially everywhere in her brain. Tanya said that during this operation, Dr. Fukushima described, quote, "It was like picking sea scallops out of the crevices of my brain," because the tumor was not just around the pituitary, but it was everywhere in her brain. Dr. Fukushima explained to Tanya that the only way he could have done anything else is if he were to put her on bypass to have a new path in place of the artery for the blood to flow. But he said doing this gave Tanya a 10% chance of survival, which Tanya rightfully did not want to do. Not just this, but during the surgery, the doctor had actually nicked her third cranial nerve. And after waking up after the surgery, Tanya was unable to see out of her left eye, which her mom explained to her that now she has third nerve palsy, which is a condition that affects eye movement. That being said, some positives that did come with this second surgery was that afterwards, Tanya's voice wasn't as tinny or deep, and it also stopped her growth hormone levels from being as high as they were. But nonetheless, her levels were still high, and they did want to get it down. Over the next few years, Tanya continued undergoing multiple surgeries, radiation, and experimental treatments. To add on to this, with the amount of pressure her weight was on her body, especially on her back, in 2004, she received not one, but 2 back surgeries. And in 2007, she received her third back surgery. But it was before that third back surgery even happened in 2005, when Tanya was almost completely moving around using a power chair, as walking was getting extremely difficult. Throughout these surgeries and treatments, Tanya also was subjected to various other health issues and hospitalizations. In 2006, she suffered a stroke. In 2009, she was hospitalized for 26 days. I'm unsure from what. And in May of 2010, she was hospitalized for 3 weeks for blood clots in her legs and lung. Something else she experienced was that due to many different factors, likely regarding her treatment and condition, Tanya was rarely ever hungry. She had a really low appetite to the point she would have to be told when to eat something and how much, otherwise she likely wouldn't eat at all. Not just this, but her speech began becoming slurred, and her hearing was affected as well, causing her to eventually get hearing aids. Likewise, one of the symptoms of acromegaly she ended up developing was sleep apnea. This, quote, is a potentially serious sleep disorder in which breathing repeatedly stops and starts. And the usual reason it happens to patients with acromegaly is because the patient's tongue often grows so large that it blocks their airways, stopping them from breathing. So every night, Tanya would sleep with a CPAP machine, aka a continuous positive airway pressure machine, to help her breathe. Despite her circumstances, Tanya was determined to live a normal life. She lived with her sister Susie. At her home, she needed to have her furniture custom made so that she would be able to use them. And doing things like getting her rings resized, her nails done, or getting custom shoes helped her feel more like herself. Before she fell ill, Tanya wore a size 9 shoe, but almost 10 years later, at 31 years old, she was at a size 15. Because of this, she was unable to find women's shoes that would fit, and she would instead have to wear men's sandals, which were uncomfortable. She was fortunately able to head to a store to pick up custom-made women's patent leather shoes from a store called the Shoe Lab in Las Vegas. These were created by a man named Jerry Guderian, who surprised Tanya with them, even adding a rhinestone with a bow because of how much Tanya liked blingy things. These were actually her first pair of feminine shoes in over 10 years. She thought wearing women's shoes like that was something of her past, so doing this meant a lot to her as it made her feel happy and like herself again. Likewise, Tanya also received custom-made clothing to fit her. Not just this, but Tanya was also able to get her rings resized at a Las Vegas store called Anthem Jewelers. The jeweler described how in his 18 years of resizing jewelry, working with professional athletes like basketball players, wrestlers, etc., he never resized rings that large. So he was happy to help Tanya. He resized her rings to be over twice the size of her old ones, enlarging them to a size 20. Additionally, as a gift, they gave her an 8-carat aquamarine that had diamonds around it. While getting these rings resized, Tanya's story was featured on the local NBC News channel in Las Vegas called News 3. And soon enough, she received a call from the Today Show, and she even received a call to feature on Inside Edition. Many news channels were very interested in featuring her story, and Tanya thought to herself, quote, "Well, if this is going to help people get to the doctor on time, I'll do it." Very shortly later, on June 23rd, 2009, Tanya appeared in her first national TV interview on The Today Show. On March 11th, 2010, she featured on ABC Nightline. The next day, on the 12th, she featured both on News 3 and on AOL Healthline. And 2 days after that, on March 14th, 2010, she featured on TLC's documentary, Help, I'm Turning Into a Giant. On September 9th to 11th, Tanya, family, and Dr. Kahita worked with a film crew to create a documentary for a show called Mystery Diagnosis, scheduled to air on the Oprah Winfrey Network in January of 2011. Likewise, the day after that, on September 12th, a major film company from Japan came to the States to film with Tanya. And sometime also around 2011, she was also featured on The Rachel Ray Show. When describing her experience filming the documentary with TLC, Tanya stated, quote, "It was a lot of fun hanging out with the film crew. They taught me a lot. They inspired me. They asked me a question like, what were your dreams? I ended up crying and they turned the cameras off. One of the producers told me, don't give up hope. And I said, you're right. And I haven't given up hope." This documentary featured Tanya also getting a manicure and pedicure at a salon with her mother, which weren't things she did often. Doing things like this was very important, just helping improve Tanya's quality of life as it took her mind off of the medical struggles she was facing. And her mother emphasized how important doing things like this were for helping Tanya feel feminine and present that way, especially because with her condition, how she was viewed and treated by society was something that was extremely difficult for her. Every time Tanya was outside in public, she would be subjected to stares and whispers. Not just this, but she would often be misgendered, with people referring to her as sir. Despite getting used to it, she described it was very uncomfortable when the stares and whispers would happen. And she further stated, quote, "People need to realize there's a person sitting in this chair." Those closest to her were still able to see her for her, so spending time with her loved ones meant a lot. While she did have a difficult time being seen and treated nicely in public, Tanya was able to find another, much different outlet through the internet. This was thanks to a woman named Tina Valle, who would soon play a big role in Tanya's life. In 2005, Tanya's mother Karen and stepfather Alan were actually looking for an apartment to lease for Tanya and her sister Susie, and it was at the leasing office where they met Tina. Tina was the leasing agent for the apartment complex, who also happened to live in the same complex. They told Tina about Tanya having acromegaly, but it was after meeting Tanya when she was signing the leasing papers when Tina instantly gravitated towards her personality and vowed to Tanya's parents that she would keep an eye out for her. After checking in on Tanya a few times, Tina learned the hardships that Tanya was dealing with. But it was just that next month in 2007 when Tina had quit her job and moved to a different state, losing contact with the family. 3 years later, in May of 2010, Tina came across the TLC documentary about Tanya. And after seeing everything she was struggling with, Tina reached out to Karen, reminding her who she was and offering to start a website for Tanya. When Karen agreed, Tina created the website called TanyaAngus.com, catering the design to Tanya's likes and personality. And it was shortly after this when Tina actually became Tanya's godmother. It was there where they would give updates, receive donations, and just share information about acromegaly. Through this site, Tanya was able to connect with so many other patients with acromegaly, share her story, listen to theirs, and actually be treated as a person. Tanya did struggle to look in the mirror as she didn't want to see her reflection and what this disease has done to her, stating, quote, "When I look in the mirror today, I see a frightened little girl who grew up into a giant. It's like I woke up one day and I was Godzilla or Andre the Giant. And it's like I'm somebody else. I look in the mirror and I don't see me." By 31 years old in 2009, Tanya was standing at 6 feet 8 inches tall. She weighed around 448 pounds and she was still growing. With this, doctors tried many different experimental treatments to see if they could stop her growth. She underwent many surgeries on her brain tumor, but none were successful in stopping her from growing. So she and her doctors put their focus on finding a new drug regimen that would be capable of doing this by lowering her levels of growth hormone. To track the levels of growth hormone being produced in her body, they measured the levels of IGF-1 or insulin-like growth factor 1 in her blood. IGF-1 production occurs in the liver, and it's stimulated by growth hormone, which is produced in the pituitary gland. It's this IGF-1 that mediates the effects of growth hormone, which together stimulates the growth of muscle, bone, and tissue in our body. According to a reference range from Sick Kids Hospital, the IGF-1 levels for a healthy 31-year-old female ranged from 87 to 312. This does, however, vary slightly, as the values depend on several different factors. For example, the University of Michigan's Pathology Handbook used a reference range of 70 to 280. So different, but still close enough for a general gist of what could be considered healthy. Tanya's level at the time was reaching as high as 4,000 and had never been lower than 1,000. Her doctor actually explained how her case is more striking, one, because of how long she's had to deal with the illness, and two, because of how substantially elevated her growth hormone levels were, which he said were high even for a patient with acromegaly. He explained this was the result of the tumor being so large at initial presentation and it not responding to the surgery attempts or the radiation therapy. With this, her mother described, quote, "They have to go above and beyond what a normal acromegalic patient would take." With her growth hormone levels being so high, Tanya would continue to deteriorate as her organs and entire body would grow. So it was important that they did the possible available treatment to try lowering it. To treat her condition, every single day, Tanya would take a cocktail of about 30 different pills, some of which she would sometimes have to take 2 or 4 times a day. Taking these pills daily was very hard on her stomach, and the fact that her appetite was very low didn't help with this. Not just this though, because in addition to this cocktail of drugs, Tanya also had to do daily injections to combat the high levels of growth hormone. These injections would be administered by her mother, who is actually a medic, as mentioned. The daily injection was likely of a drug commonly prescribed to patients with acromegaly called pegvisomant, also known as Somavert. This is a growth hormone receptor blocker and is also referred to as a growth hormone receptor antagonist, meaning it works by binding to growth hormone receptors in the body, thus blocking the binding of the naturally produced growth hormone in the body. The thing is with these injections though, is that whenever Tanya would get them, they would burn really bad. But this wasn't all she had to do. She would see multiple different doctors for different treatment. One of these doctors was a man named Dr. Michael Jacoby. Sometime in 2009, Dr. Jacoby prescribed Tanya with another injection of a very strong drug that she was meant to take once a month at the maximum permitted dose. This was an extremely painful injection. The drug was very thick, similar in texture to petroleum jelly, and in addition to this, they would have to use a 20-gauge needle, which is very big. So big, it would actually leave a hole in her skin whenever injected. Her mom would administer this injection with the help of her sister, who would help console Tanya. The once-a-month injection was of a drug called lanreotide, also known as somatulin autogel. This is a somatostatin analog, meaning this is a synthetic version of the natural hormone somatostatin. This is also referred to as a growth hormone inhibiting hormone, as it works by decreasing the amount of growth hormone somebody releases. The three broad classes of drugs used in the treatment of acromegaly are somatostatin analogs, dopamine agonists, and growth hormone antagonists. As of today, there are 13 medications listed on drugs.com as being related or used in the treatment of acromegaly, though at the time of this case, there was much less. Tanya was already under agonizing pain daily from the amount of pressure her body was under from her growth, especially in her back. So these injections just added to that. She described that she thought she was just, quote, born to live through pain, and described that her pain level is not even fathomable, especially whenever asked in the hospital to rate it on a pain scale. Though she would still remain the same size and deal with the struggles that came with it, she just had hopes that the new drug regimen would reduce her growth hormone levels to stop her from growing. Her doctor explained that most of her pathology is permanent, whether it be her joints or her height, but working to bring her growth hormone levels under control was important in ensuring she had a better chance of staying alive. Many doctors told Tanya that she would be gone by 30 years old. But she was 31 by that point, so this number then got pushed to 40 years old. She was constantly given different lifespans by different doctors. She got to a point she was not afraid to talk about dying young, and she knew she had a limited lifespan, but she wasn't going to let this affect her.
I mean, my doctors have stamped the date I'm going to die on my feet 10, 15 times. I've heard you're going to die so much that I can't believe it now. Why did so many doctors give up on me?
It was very emotional for her speaking about the prospects of getting married, as she couldn't see any man marrying her. And it was also emotional knowing that she wouldn't be able to have children, especially with all the cysts she had around her ovaries from her condition. She stated, quote, "Knowing that I can't reproduce is like a kick in the head." The monthly injections Tanya was doing were new, so Tanya eventually needed to have a follow-up with Dr. Jacoby to make sure it worked. The day before she had this follow-up in December of 2009, she went to a casino in Las Vegas with her mom and sister, which she really enjoyed with her family, even emphasizing that her mom was her rock and that she'd share the $1 million with her if she were to win. When she went to sleep that night, she just had hopes that in the morning she would hear great news. She and her mother went to Dr. Jacoby's office the next day, and this is what he told them. He said to them that when he first started seeing her, her IGF-1 levels were consistently over 1,000, sometimes even 2,000. But on this very day, Tanya's levels were sitting at 644. They were down by twofold. Since April 25th, 2002, about 7.5 years ago, her levels had never been that low. Her mother, Karen, said how this was the first time since she was diagnosed where her levels were under 1,000. While 644 was still above healthy levels, this was a huge improvement and meant that the new drug was working. And with her growth hormone now being reduced, they expected for her amount of growth to be reduced as well. Dr. Jacoby was extremely happy with this, and he even thought that there was more room for improvement as well. Although Tanya would still have to take medications for the rest of her life, he was hoping that the decreased levels would translate to her feeling better in the future, which Karen described as, quote, the best Christmas present we could ever have, knowing that they were finally gaining control, which is something they hadn't had before. Tanya described that she, quote, had a brand new lease on life, even excitedly stating that she would take the injections twice a month if she had to, as long as her levels continued to drop. But despite all the excitement, unfortunately, this drop in her levels was very short-lived, because it was just within those next couple months when Tanya's levels were back to being over 1,046. By that point, Tanya was speaking to different medical professionals to figure out what to do, and she somehow got in contact with a surgeon named Dr. Daniel Kelly to discuss some options. Dr. Kelly worked at the John Wayne Cancer Institute, now known as the St. John's Cancer Institute in Santa Monica, California. And after some discussion, they decided that they will perform another brain surgery on Tanya. They initially had Tanya scheduled to complete this surgery on Thursday, June 17th, 2010. However, Dr. Kelly and his colleagues had further discussion with one another, and eventually they figured that doing another brain surgery on Tanya would be too risky, and they decided to not go through with it. Dr. Kelly told Tanya that they wouldn't be performing a surgery because of the high risk of her experiencing paralysis or ultimately losing her life. However, he did say there was another option. There was an endocrinologist in San Francisco, and Dr. Kelly told Tanya that he'd like to refer her to him, which Tanya agreed to. The initial meetup with the endocrinologist was scheduled to take place in October of 2010, though, according to her mother, Tanya had already outgrown 3 vehicles at that time, and she was unable to fit in the standard plane seat. So they had to figure out how they were going to get her over to California. Fortunately, this transport was made possible by the American Medical Response, or AMR's, Medic West ambulance. And even the following month, on November 10th, 2010, using AMR, she was able to travel again as a production company flew Tanya to New York to be featured on a TV show speaking about acromegaly. Tanya's mother stated it would be once they reached 300 when they would finally be able to consider her as being in maintenance. It was just a matter of continuing with the follow-ups to see how the treatment was working, which it wasn't too long after this when it was looking like this was a possibility. In December of 2010, Tanya had gotten some lab work done to see her hormone levels. And to her and her family's fortune, the results showed that her levels had finally dropped down to 214. And it stated on her site that for the first time in 8 years, Tanya's growth hormone levels were finally in the normal range. Tanya and her family were extremely excited about the result, which was announced on her website on Sunday, December 12, 2010. But unfortunately, this excitement was very short-lived. Just 3 days later, on December 15th, Tanya was admitted into the hospital with pneumonia. But this wasn't just a short stay. During those next few weeks, she was faced with an intestinal blockage and a 16-millimeter kidney stone. And just the next month, in January of 2011, results showed that Tanya's growth hormone shot back up to a very high level. Not just this, but during this hospitalization, they found a polyp in her colon, and she was soon required to undergo surgery to remove her gallbladder and the 16-millimeter kidney stone. She was released from the hospital on Monday, January 10th, 2011, and her growth hormone levels remained high for quite some time, being above 1,000. To treat this, according to ABC News, doctors prescribed Tanya with a bumped-up dose of one drug. I'm not sure which one exactly. But fortunately, as those next months went by, Tanya's hormones began returning to relatively good levels. By May 24th, 2011, her IGF-1 levels were at a 602, which was high, but still far better than before. The lanreotide monthly injection not only lowered her growth hormone levels, but it also helped her lose weight. At that time, at 32 years old, Tanya was 6 feet 11 inches tall. Before starting, she weighed 450 pounds, but at that time, she was 344 pounds. As time went on, Tanya felt like it was her mission to bring awareness to acromegaly so that people know that it can happen to anyone. As mentioned, she went on to speak on different platforms, including in person to the Dr. Oz Show and virtually to the Dr. Drew Show in 2012. And she even was featured in a brand new nursing textbook around 2011. When she was on the Today Show back in 2009, she met a man named Robert Bob Knutson, who told her how he used his computer to start his own acromegaly support group called Pituitary Network Association. When he started it, Tanya didn't have a computer at home at the time, so she was hoping somebody could donate one so she'd be able to help out with his website. Eventually, she did get a computer, and this was how she was able to run her own website as well. Additionally, Tanya was invited to speak at different events, including an acromegaly conference hosted by the online organization Acromegaly Community. This group was founded by a man named Wayne Brown. Wayne was a history teacher from Buffalo, New York, who was diagnosed with acromegaly in 2004 after suffering with jaw pain for years. After his diagnosis, he tried searching for resources online, but he was never able to find anything. He even tried going to support groups for patients with brain tumors, but with how different acromegaly was, he was never able to fit in with these groups. So because he had no luck finding other patients with acromegaly, he used MySpace and then Facebook to start Acromegaly Community. With the support group on Facebook being active since 2007, growing to over 3.6 thousand members, as well as the public page with over 3,000 members. With this group now being there, patients with acromegaly were and still are able to discuss both the physical and mental things they go through that only they would understand, and they are able to connect with others going through similar things they're going through. Wayne Brown emphasized how important the mental aspect of all of this is, because many patients do struggle mentally while living through the condition. He's been told by others that being able to connect through the support groups helps keep them going. By 38, in March of 2011, Wayne published a book called Alone in My Universe, Struggling with an Orphan Disease in an Unsympathetic World, which features a compilation of his story and those of others with acromegaly. Tanya was invited to the Acromegaly Community's first ever patient conference hosted from May 6 to May 8, 2011 to share her story and raise awareness about the disease. In fact, they even held the conference at the Mirage Hotel in Las Vegas just so she'd be able to attend. It was there where she told others how they can pay for grants for the medications, which was very important as some of the injections can cost even up to $5,000 per shot. So it adds up, especially when you're doing multiple. Tanya's medication at some point was looking to even cost around $40,000 per month, which is about $60,000 today. The organization got an enthusiastic response from the pharmaceutical companies who attended the conference. Likewise, Tanya's mother described that Tanya was viewed as a hero by the other patients with acromegaly. Many of the patients with acromegaly approached Tanya to tell her that it was after they heard her story when they felt encouraged to seek treatment early on. And it was likely due to this their lives were saved. Reflecting on the conference, Tanya stated, quote, "Sometimes, yeah, I'll feel really down about it, but to me, the most important thing, I have to help the people." Further describing the response she's received from others, stating, quote, "I read emails that people send in saying, 'You're my inspiration,' or 'You are so strong.' If I am helping other people, I feel I can do anything." The following year, in 2012, Tanya even attended the conference again from June 6th to the 8th. Additionally, it was also that year where she received an award from the Acromegaly Community for all the work she had done sharing her story, raising awareness, and inspiring others in the acromegaly community and just in the world in general. When asked why she wanted to share her story, she stated, quote, "I want people to know that anybody could have this disease. 1 out of 5 people have some type of pituitary tumor in their lifetime. And if you do have a tumor, the faster you find out, you won't look like me. I'm an extreme case. I used to be pretty. I was skinny. I was into modeling. I was a dancer. I don't look pretty now, and I'll probably never get married, even though that was my dream." Dr. Lawrence Katz-Nelson, a professor of medicine and neurosurgery, was also a medical advisor to the organization. He described, like Tanya, it's usually a slow onset for patients noticing changes in their body. He stated, quote, "Patients don't present with, I am getting bigger. You look at photos and their history over 10 years and you see it. But when we look in the mirror every day, we don't see the changes. He further emphasized the importance of more information being available about acromegaly, stating, quote, "There is so much information about cancer and heart disease out there that's easy to obtain, but if one happens to suffer from a rare disease, the information isn't readily available in a coherent manner. We need books and patient groups to support these people." Tanya stayed optimistic and was determined to live for as long as possible, even stating, quote, "I intend to stick around for a long time." They really needed Tanya's growth hormone levels to go down if they wanted to ensure her health didn't decline quicker. Using the same medications, they were adjusting the dosing to make sure the drugs were working. Sometime around 2012, Tanya's mother, Karen, had led some experimental changes in Tanya's growth hormone regulating injections. And on Thursday, August 30th, 2012, a status update for Tanya was posted on her website that showed this new dosage might be working. Tanya did some preliminary blood work showing her IGF-1 levels were down to 283. All they needed was secondary blood work results to come back confirming this. Likewise, she completed an MRI, and this showed that there was zero growth of the pituitary gland tumor. This post announced that for the first time since Tanya's original diagnosis of acromegaly, her IGF-1 levels were normal. Now, if you remember their prior post in December 2010, they announced that her levels were normal for the first time at 214. So I'm unsure if they didn't count the previous one because it was very brief. I'm not sure. But both posts were from Tanya Angus's website, so I just had to mention that. Now, unfortunately, despite the exciting news, this time again, it was very short-lived. Because it was on October 4th, 2012, when a status update was posted, announcing that Tanya's recent blood work showed that her levels were back up to the 500s. On November 27th, 2012, Tanya celebrated her 34th birthday with some of her closest friends whom she inspired so much.
I'll lie. Happy birthday. I'll lie for your birthday all day long. Tanya, keep moving forward. Thank you for being my hero. Serving my country means serving someone as special as you. Sergeant First Class Tyler. Happy birthday, Tan. You're an inspiration to many. Enjoy your day. Ronnie and Rose Sova.
Just a little over a month later, by January 2013, she was standing at 7 feet 2 inches and approximately 400 pounds. For so long, her organs and body had been faced with so many health issues because of her size due to this condition. And it was just after midnight on Monday, January 14th, 2013, when Tanya passed away at 34 years old. Tanya's godmother, Tina, ran a blog called Tina for Tanya, and she announced on it, quote, "It is with deep sorrow that we announce the passing of our beloved Tanya Angus at 12:25 a.m. on January 14th, 2013, due to her heart and TIA. Rest in peace, dear one." TIA refers to a transient ischemic attack, which is, quote, "a temporary blockage of blood flow to the brain." According to a few sources, supposedly Tanya had suffered a number of these in recent years, but I haven't been able to find any more information on that. Tanya was remembered by many for how courageous she was. Dr. Kihita described her as a great patient with perseverance. Her mom and sister also described how determined she was, with Susie describing how she was fighting tooth and nail to live. Tanya didn't want anyone to go through what she had gone through, so she shared her story hoping that she can help others, which she definitely has. The article from ABC News mentioned that centuries ago, patients with acromegaly would often be made a spectacle, whether that entailed being recruited to the circus or even starring as some kind of monster in a film. They mentioned the example of Richard Kiel, who played a villain's sidekick named Jaws in James Bond movies. And as Tanya mentioned, Andre the Giant, the wrestler. But today, patients more so are able to share their story and bring more eyes to what's truly happening inside their body. Tanya's case was one of the most advanced cases in the world. Many patients don't grow to the size Tanya had. In a lot of cases, somebody who doesn't know the person might not even know that the person has acromegaly. It's very likely that had she been diagnosed much earlier, they would have been able to control it much better. When Dr. Kahita answered how this could have been missed for so long, she explained that the signs and symptoms leading up to the diagnosis are often vague, so it might be harder for physicians to diagnose the patient unless they knew them before and knew how they once were like or looked like, especially since the condition is rare. But even so, it's very unfortunate that after going to so many doctors over the years, not one doctor took her seriously enough until it was a doctor who personally knew Tanya. While treatment has improved, more work still needs to be done. Some big news is that in June of 2020, the FDA actually approved the first and currently the only oral medication to treat acromegaly called Mycapssa. This is actually the oral version of one of the injectable drugs, octreotide. This is the first and only oral somatostatin analog. According to GoodRx, it's used as maintenance treatment for acromegaly in adults. It's for people who have first done well with injectable somatostatin analogs like octreotide or lanreotide. And Mycapssa is a capsule that's taken by mouth twice a day on an empty stomach. More recently, on December 9th, 2024, the FDA accepted the new drug application for investigation of another drug called paltusotine. This is an oral non-peptide agonist intended for once-a-day administration for patients with acromegaly. So that is currently in the works. Overall, acromegaly is a treatable condition, especially when diagnosed early, and many patients are able to experience significant improvements in their symptoms after treatment. The treatment can and does come with some tough side effects, whether that be nausea or fatigue, amongst many others. And there are a lot of physical and mental side effects that come with the condition, as Tanya had discussed. But with proper care, treatment, and support, people with acromegaly are able to lead fulfilling lives. It's important for patients and their care teams to be proactive about any associated health concerns and management for it. And it's also important for everyone, just in general, whether it be doctors and even the public, to know about the signs and symptoms of acromegaly so patients are able to get an early diagnosis. As discussed, these symptoms can include changes in body parts, whether that be a broadening nose, gaps between teeth, an enlarged tongue, enlarged hands and feet, but could also be things like skin changes like acne or thickened skin. And then there's other symptoms like headaches, deepening voice, vision troubles, tiredness, or joint pain. Also for females, irregular periods is something common in patients with acromegaly, as Tanya had too experienced. Pay attention to the signs and symptoms. Always get checked out by a health professional if anything feels wrong, and advocate for yourself or for anyone else who needs it. Tanya's advocacy did a lot for patients with acromegaly. Her advocacy is continued through her website, tanyaangus.com, which is still up today. And it's being operated by her godmother, Tina, alongside a Facebook page dedicated to Tanya. Tanya's story truly has inspired me as I was researching it, so I hope I was able to cover it as cohesively as possible, and just encourage you to just read up about it and just read more on her and watch her documentaries and her videos, because she's really well spoken, and it's nice to hear her speak about her attitude towards things, despite going through so much. And just some words of wisdom from Tanya.
I won't ever give up. I won't ever, because, like, a good friend of mine told me, anything's possible.
But yes, that is it for this video. What are your thoughts on Tanya's story? Are you shocked at how her symptoms were just brushed off by so many doctors at the start? Please comment your thoughts below, and don't forget to subscribe so you don't miss any other videos on medical cases, crime, and mysteries. Bye now.